My daughter went into active labor at home. We took her to the hospital. She called ahead of time, so we know they are expecting us. However, we get there to the emergency room. We watching nurses, putting gloves on, running to the door. They get outside of the door, and I drive a black SUV, and they look at my vehicle, and one of the nurses come up to the window, and she goes, I'm sorry, this is for ambulance only. I said, well, my daughter is in active labor. And she was like, okay. She said, but you're going to have to go to the front.
Right now. Is your What? How many times have you been pregnant? 3. This is your 3rd pregnancy? Yes. You have 2 babies. This is my ass. You have 2 babies at home? Who's your doctor?
Lang is her doctor. Y'all treat all your patients like this or just the black ones?
This is why I always talk about on my channel. I'm sorry, I'm emotional. This is why I always talk about on my channel that as a woman, making sure that you are thoughtful as possible as you can be about who you allow to have access to your womb is so important. Because imagine going through all this as a mom and the man that impregnated you is not supportive. It's not there. You have no representation. That's why you need your mom to be there with you. Pregnancy for black women is dangerous. Getting pregnant, every time a black woman gets pregnant, she is ushering herself into a state of danger. Because there's no guarantee that we will be treated correctly. Even if you do it right? Even if you have a husband that loves you and takes care of you and he's out in a car or he's out in a lobby or he's waiting at home or whatever he's doing to try to better life for you in preparing for you to give birth. This is what you could run into. You could go to a hospital and have someone completely show you apathy. Apathy. While you are literally screaming in pain. The baby is literally tearing through your body. And someone is sitting there, name, doctor. It is imperative that women, in particular black women, because there's a special insidious kind of racism that we face at the hospital. It is important that we stop looking at pregnancy as just something that happens, just something to do, and we start looking at it as a life or death situation.